Hey guys, this is Dr. Oubre here. I wanted to spend a little time and tell you about who I am and what I do. So I'm a board certified family medicine physician. I used to be just kind of a regular general practitioner, just like anyone would go see for a well checkup or anything like that. And I started getting into functional medicine and doing more advanced lab testing. And then I did some training with the Institute of Functional Medicine and just kind of fell in love and started doing pretty much only functional medicine. And I left my general insurance-based practice and started practicing out here in Dripping Springs, where I'm inside a pharmacy. And I kind of treat people as a whole instead of disease-based. In the insurance model right now, it seems to be that you have a medical problem, a symptom, and you show up to the doctor's office and they basically just give you a prescription and send you out the door. The average time spent with patients right now, I think, is between 10 and 12 minutes, which is absurd and disappointing, unfortunately. I don't think it's any doctor's fault. It's just kind of the model right now. And so what I focus on is instead, my visits are usually anywhere between 60 and 90 minutes and sometimes longer depending on the complexity of the visit. And I get all the symptoms and the whole story down, and then we come up with a treatment plan, and it really starts from the ground up. We focus on the gut, we focus on hormones, we focus on stress, and we put together a plan for someone, and it involves nutrition, it involves exercise, supplements, and sometimes even prescriptions. Many of my colleagues are anti-medicine and anti-prescriptions, and I wouldn't consider myself anti-medicine at all. It's how I was trained. I was trained in conventional medicine. I consider myself that I've delved into functional medicine, that I use a lot of supplements and natural treatments, but I'll still use prescriptions when they're needed. In general, I try to get people off of prescriptions because for most people, I don't believe you were born with an omeprazole deficiency or a statin deficiency. And so if possible, I'd like to get you off of medicine. However, there's some medical conditions that just need a little extra push and they need that prescription medicine, and I'm happy to use it when we need to, and when it gets to that level, but I always prefer to do things naturally. And so my main pillars are food planning, and that includes eliminating foods, adding foods, eating plenty of vegetables and fats. It includes hormone balance, stress reduction, and really gut health. And so there's a lot more that I do, but those are the main pillars that I focus on. And I use advanced lab testing that you've probably never even seen before. And in my future videos, I'll be going over some of these advanced lab testing and showing you what we do and how I do it and how different it is. But luckily, with this day and age, we've got such amazing advanced lab testing that I can really tell so much about you without even touching you based on your lab results. And it's all about looking at them with a microscope and really delving into them and trying to figure out your story and how your labs affect you. So that's a little bit about who I am. I want to show you where I'm currently practicing out in Dripping Springs. And so I'm going to show you in the background that I'm currently inside the pharmacy. Sorry, the sun's in my eye. You can see the pharmacy name in the background, Dripping Springs Pharmacy. And so that's where I'm practicing right now. I've got a room inside the pharmacy that I rent out, and the people at Dripping Springs Pharmacy are amazing. So if you're in the Dripping Springs area and you're just using a big box pharmacy like Walgreens or CVS, I really encourage you to come over to the Dripping Springs Pharmacy and check these guys out. They're super nice. They know you by name usually if you come here for a while, and it's good people. So support local, and you won't be disappointed with them. So hopefully that explains a little bit about who I am and what I do, and I'll be doing more videos. So please like and share my page and my videos so that we can spread the good word about how to restore people's health naturally. You don't even have to be my patient to do this. You can take many of the advice and steps that I'm giving you and try to put them to use and see if it helps. So hopefully it does help. Like I said, like and share the page. I sure appreciate it. You'll have a good day and a happy Turkey Day.